Welcome back to the Breakfast Show 2. I'm here this morning with Shawnna Rhine from the Southern 7 Health Department. Good morning, Shawnna. How are you doing?
I'm good, thank you.
Good. So back to school is starting today, yesterday, the day before. Everyone is starting to get back to school. But before people maybe head off to school, we need to talk about those immunizations, those shots that children will need. Let's talk a little bit about, specifically what shots are students kind of, needing to get before school?
Well, a lot of it's going to depend upon their age and what grade level they're going into. So if someone is concerned about where their child is at those vaccination levels, they can talk with their doctor about that, or they can even get the information from their schools.
And so to get back to school shots, is that something that the health department does for parents and children?
Sure, yes. Southern 7 Health Department does provide those. Actually, pretty much any local health department does that as well. So we're just, encouraging families to not wait until the last minute. I know, like you said, some schools are already starting, some still have a couple of weeks, but it's important to get those vaccinations in play. That way the child's body has enough time to develop that protection against that particular virus.
And I know for the younger kids who maybe aren't really exposed to all of the germs quite yet, they could get sick easier because maybe, like I said, they haven't been exposed. So how important is it to, get those vaccinations before they head off into a group of all other children?
You actually said it very, very correctly on that. A lot of children, by the time they reach kindergarten, already have had some of those vaccinations that they need. It's just you have to continue to get the boosters as time goes on. But if you have a child who's immunocompromised for whatever reason, or is not able to be vaccinated, again, for whatever reason there, it's important that you're protecting those children as well as your own. So making sure that those vaccines are current, again, gives them that protection against those illnesses. We tend to not think so much about measles and mumps and chicken pox and those, but they're still out there. And as we see, we are starting to see an increase in measles and chicken pox in our country. So it's important to get those vaccinations in play as soon as you possibly can.
And I know since the pandemic, it might have caused people to stop going to the doctors. Have you noticed where, more people aren't getting those shots right away, or what does that look like for the health department?
Well, the health departments as well as pediatricians did see a decline in vaccination rates during COVID. A lot of that was just part of that, social distancing and not getting out to those regular appointments. We are starting to see families get back on schedule with those and get that done, so that's good. But at Southern 7, we're constantly encouraging them to make sure you're up to date, no matter what time of year it is. We've been talking to our families since April to get that done. You just don't want to wait to that last minute. You got to consider that a lot of times your clinic or your health department or your pediatrician sees other patients too. So we know how hard it is to get those appointments on an everyday basis. So waiting till the very last minute to get those shots done can delay the process. And it also could make it to where your doctor doesn't have the vaccine that you need at that time, because they do have to order things in advance. So it's important to schedule them early.
Right. And so then have you guys been relatively busy, this first couple of weeks of August and the end of July? We have.
We actually started seeing an increase in vaccines in June. We have 7 public health clinics that we cover, since we cover 7 counties. And some of our counties do see higher rates than others, depending upon if they have a pediatrician in their area. But yes, we have seen that increase. We have seen families get on board and get that done. Remember, there's paperwork involved from your school. There's a lot that has to go into play to get that process going.
And say, for instance, if I were to have, just a regular doctor, but that doctor can't get me in time, would I be able to come to the health department and get those shots just as easy if I were to go to, my primary care doctor?
Again, it depends upon if the vaccine is available at that location. It also depends upon, just the general scheduling and other patients. So if your child is, a couple weeks out from getting, into the classroom, go ahead and get that scheduled now. If your child is starting this week, still go ahead and get that scheduled. Usually your state will allow you a little bit of a grace period. So as long as the school knows that you've got something, you've got an appointment set, that will get you what you need.
Wonderful. Is there anything else that you feel like parents and children that they need to know before heading back to school for these, immunizations?
Right. Well, other than the COVID vaccine, the vaccines that your children are getting have been around, some of them for decades. So they are proven to be safe. They are proven proven to be effective. It's one reason why you don't hear of measles, mumps, and chickenpox and all the others as often, because kids do get vaccinated. So it's important to remember they are safe, they are effective, they do what they need to do. But again, it's between you and your doctor on what is best for your child.
Well, Shawnna, thank you so much for coming on to the Breakfast Show and talking a little bit about those vaccinations and just how we need to go ahead and get the kids vaccinated before school does start. We'll be back in just a few minutes.